All right, everyone, I want to thank our sponsor today, Organifi. You know, we talk a lot on this podcast about healing and the healing journey. Well, an integral part of that are the foods and the drinks that we consume. I know you know this. If you're like me, you know the importance of eating healthy, but you don't always have the time or the willpower to cook with all the colors of the rainbow. Organifi's superfood blends make it easy and enjoyable to add more variety and nutrition to your day. These are delicious organic powders that you can add to water or milk, stir and drink. It literally takes 30 seconds. It is that simple. A couple weeks ago, I was right about to start a green juice fast, a kind of a short mini fast. And I kid you not, the night before, Organifi reached out to me about sponsoring this podcast. And I will tell you that I was thrilled because this is aligned with what I'm doing. I'm familiar with Organifi. I've used them in the past before. I want to be able to bring to you quality products and things that are going to promote a healthy lifestyle. Organifi green juice is the one I use. It's the one I use every morning so that I know right away I'm starting the day on a healthy note. It's loaded with vitamins, loaded with minerals, and essential antioxidants. As a listener of the Trauma Therapist podcast, you can get 21% off any item by going to Organifi.com/trauma and use the code trauma. Once again, to get 21% off any item, go to Organifi, that's Organifi.com/trauma and use the code trauma. All right, everyone, I want to thank our sponsor today, Organifi. You know, we talk a lot on this podcast about healing and the healing journey. Well, an integral part of that are the foods and the drinks that we consume. I know you know this. If you're like me, you know the importance of eating healthy, but you don't always have the time or the willpower to cook with all the colors of the rainbow. Organifi's superfood blends make it easy and enjoyable to add more variety and nutrition to your day. These are delicious organic powders that you can add to water or milk, stir and drink. It literally takes 30 seconds. It is that simple. A couple weeks ago, I was right about to start a green juice fast, a kind of a short mini fast. And I kid you not, the night before, Organifi reached out to me about sponsoring this podcast. And I will tell you that I was thrilled because this is aligned with what I'm doing. I'm familiar with Organifi. I've used them in the past before. I want to be able to bring to you quality products and things that are going to promote a healthy lifestyle. Organifi green juice is the one I use. It's the one I use every morning so that I know right away I'm starting the day on a healthy note. It's loaded with vitamins, loaded with minerals, and essential antioxidants. As a listener of the Trauma Therapist podcast, you can get 21% off any item by going to Organifi.com/trauma and use the code trauma. Once again, to get 21% off any item, go to Organifi, that's Organifi.com/trauma and use the code trauma. Trauma Therapist Podcast, episode 388. Welcome to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to help support and inspire new trauma workers through this podcast and my membership community, Trauma Therapist 2.0. Thanks so much for joining me today, and here we go. Hey folks, Guy here. Quickly before we get started, after having done over 380 interviews with the amazing guests that I am fortunate to bring on this podcast, one of the themes that continually comes up again and again and again is the importance of self-awareness, of authenticity, of presence and vulnerability, and how to cultivate that. This topic is my passion. It inspires me. Why? Because it's something that I've been on a journey to do, and all within the context of working with people who've been impacted by trauma. I want to invite you to join me for a live workshop September 20th through 22nd at the Incredible Art of Living Retreat Center in Boone, North Carolina. Once again, that's September 20th through 22nd. You can get all the information by going to theheartcenteredworkshop.com. That's theheartcenteredworkshop.com. I will see you there. Trauma may be a fact of life, but it doesn't have to be a life sentence. Somatic experiencing is a psychobiological method of addressing clients' physical and emotional trauma conditions and helps to give voice to their experiences without a need for them to retell their story. SE is a complementary modality that focuses on regulation of the nervous system and offers the opportunity to engage, complete, and resolve the body's instinctual responses to traumatic experiences. For more information regarding somatic experiencing and the SE professional training program, please visit www.traumahealing.org. That's www.traumahealing.org. This episode is sponsored by Trauma Therapist 2.0, community to educate, support, to inspire new trauma healers. If you're a new trauma worker, new trauma provider and healer, you're starting out on this trauma-informed journey and you're tired of doing this alone and looking for support, looking to be around a community of other passionate trauma clinicians, I invite you to check out Trauma Therapist 2.0 at traumatherapist2.com. That's traumatherapist2.com. All right, guys, welcome back to Trauma Therapist 2.0. Today, I have back Cynthia Price. She was a guest on the podcast, and as you recall, Cynthia is a body therapy researcher. She studied massage therapy in 1981 and was in private practice for 20 years as a body psychotherapist before pursuing her doctorate to do research in the field. Now an associate research professor at the University of Washington, Cynthia's research is focused on the study of mindful awareness in body-oriented therapy, or MABT, a body therapy approach developed to teach interoceptive awareness skills for self-care and to facilitate emotion regulation. Cynthia, thanks so much for doing this. This topic is, I love it. I mean, it's right up my alley, what I'm trying to talk about and promote here with everything I'm doing. So thanks again.
Mm-hmm. It's a pleasure to be here.
All right. So let's talk. We talked a little bit about, before we started recording, about the goal here, which is to, get specific, share with our viewers the specifics of how this process works, how you've worked. How would you like to start? How do you want to get to that point?
So the specifics of the particular approach that I use, I can break it down into pieces if that would be helpful, which is often how I talk about it and teach it, which is that this approach is taught in a really incremental way so people can build on the skills that we're teaching them, and the therapist can too. So we start by really helping folks learn to find words to describe and first identify and then describe sensory awareness, because a lot of folks with trauma histories, that may not be something that they have a lot of experience doing, especially if they don't pay attention to their bodily sensations very much. So to do that, we start really more on the external part of the body by providing some tactile pressure in a particular area and asking the person to describe the sensation that they feel in that part of the body.
So just let me just interject here. So we're talking specifically about MABT, right?
We are.
Okay, so this is mindful awareness in body-oriented therapy. Okay.
We are. And so we have 3 stages in our training process, and that we work with clients to learn. And we start with this, what we call body literacy, helping people to identify and articulate sensation, and that's more on the external realm of the body. And then we move to helping people bring their attention more internally in the body. So that's developing interoceptive awareness skills, awareness of internal sensations in the body. And we do that by, we've helped folks start to use words to describe sensation. So now we're helping them notice sensation internally. So we start I'm just kind of walking you through these stages that we do. So we start there, then we move with different ways of helping people start to bring attention internally. And then the last part of this approach, the biggest time-wise, is helping people to really learn to sustain mindful attention in very specific areas of the body, still using the skills that they've already learned. What are they aware of? How would they describe what they're aware of? And then learning to sustain attention in that area, to notice how things shift with sustained attention. And that's really the mindfulness piece. Mm-hmm. It's that present moment, sustained attention in a very specific area of the body. And we usually choose places that are of real interest to the client. So a place where there's body memories, a place where there's somatic discomfort in some way, that's already kind of in their awareness as being a place that they're having some difficulty with. So, for example, folks who have trauma histories may be aware that they get anxious, and their anxiety they're aware of it as being sort of generally in their stomach, for example. So with this work, we might be focused on that area of their body. How can they bring their attention down? Can they access interoceptive awareness in that part of their body, in their stomach? And then can they learn to sustain awareness there and notice what happens when they do? So what's useful about this, all of this, mm-hmm. is from sort of taking a big step backwards, is with sustained mindful attention, with the capacity to do that in a particular area of the body, things shift. Physiologically, one's sensations in the body shift, one's sense of that part of the body shifts, and that happens on many levels. So it happens with how one experiences that part of the body, the emotional relationship to that part of the body, and one's sense of, and usually in a positive direction. So if, for example, the area that we're talking about here, like someone's stomach, if they find that that's a really anxious kind of place, and when they go down in it with sustained attention, it shifts from being this perhaps kind of dark, small, kind of scary place to, over time, a place that's really comfortable to be in, that's open, and if it is anxious, they can manage that anxiety and be with it, and then it'll shift, and their sense of the space in their belly shifts as well. So you have a question?
Yeah, you talked about starting out inviting people to kind of observe external sensations, and then moving to internal. I can guess why, but share with us why it goes like that.
Well, for one thing, it's, as I said, we're trying to be incremental to teach skills that build on each other so that folks feel comfortable as possible with the process, and so that they're starting with really fundamental skills of learning to simply have language. So we're working with language a lot. What are you aware of? How would you describe what you're aware of? How can you integrate that awareness that links physical sensations with emotional sensations? So if people don't have language to describe what they feel, we can't really move forward. So that's where we start. I don't know if you're familiar with the term alexithymia, but in this more psychological, psychiatric literature, this is it's the inability to really know or be aware of and be able to identify and describe emotions and sensations. And so we're working on really developing that skill first. Mm-hmm. So most people who are unfamiliar with accessing inner body sensations, if you try to just jump in at that level, it can be hard to do, it can be very challenging to do so. So we're also trying to just follow a path that feels safe and that builds on people's curiosity and capacities. So when people notice, oh yes, I can notice that this area on the top, on my left shoulder, for example, which I have a lot of discomfort, I can identify how that feels. I can tell you how it feels. The shoulder feels tight, the muscles feel tight, it feels like a cold, empty place. Like the ability to say that and notice that just from sort of the attention to external sensation, or it's not so totally external, but we're not asking someone to bring mindful attention inside that area, is where we start. So it's just sort of kind of building, it's skill building. Does that make sense?
It makes a lot of sense. And so MABT, are you teaching this for consumers or clients, or is this something to be taught to therapists or trauma workers, or both?
Well, we're teaching therapists to do this work, so they're teaching their clients to do this work on their own. So the trainings are for therapists in order to have this set of skills that they can work with for their clients. In the context of teaching therapists, They learn to do this work themselves. They get the experience of it. You can't really guide someone down this pathway if you don't really know what it's like yourself. Sure. So yeah.
Okay. So one of the things that comes up for me is, as you're talking, there's a lot of similarity in sensory motor psychotherapy or somatic experiencing or even Hakomi. How does this differ?
Well, some of how it differs is that there's a lot of overlap, actually. The touch-based piece is probably one of the biggest differences, since a lot of those approaches body workers may train in and then translate that into their bodywork practice, but they're usually, the educational experience doesn't involve touch. We're using touch at every step in the way to help guide someone's attention to a very specific part of the body and to help them use touch, starting with the therapist, but then when they go home and integrate this work into their own daily lives, their own self-touch, as a way of really grounding their attention in their bodies and helping them stay there, because sustained attention is the biggest kind of key element of learning to really do that, and it's easier to do when you've got some touch to guide your attention and remind you of where to keep conscious attention in the body.
Yeah, thanks for that explanation. And I could imagine that too. I mean, and touch is such a hot button topic in and of itself. But let's talk about, I don't know if there's an example of how maybe you've worked with someone and you've introduced that touch, and let's kind of move down a little and get more specific in terms of what this might look like with a particular person or client. Okay.
So starting from the beginning of the process state, of this that I'm talking about. So if we take this same kind of idea that we've got someone who's got anxious stuff going on in their belly, and it causes a fair amount of discomfort. So we'll say someone comes into the office saying, I'm in treatment for my recovery from my trauma history, and I'm here to see you because I've got these body symptoms that are really bothersome for me, and I don't know what else to do about them. So that might be why someone would come in to see me, for example. So we would start with exploring this body literacy beginning place of like, well, what do you notice in your body? Where are you tense? Where all do you have symptoms? When do they show up? Just kind of exploring that, and then moving into helping this person talk about what they notice on a sensory level in that part of their body, in their belly. Then we would move into a subsequent sessions and teaching the person to start bringing attention, mindful attention, deeper on the inside. So actually traveling with their mindful attention right down into this area of the belly. And the therapist would actually hold on the back side and the front side, the belly, so that the client's attention is very clearly defined of where they're going. They're going in this space between the therapist's hands. And the therapist, and this is another very key way in which this approach is different. Therapists who are using their hands and doing this work can assess through their hands whether the client's attention is in the belly. Now, you can do that in other ways. You can sometimes just really tell that someone is very mindfully present in a very certain part of the body without touching them. But in this work, it's a wonderful feedback for the client, for the therapist, that the client is actually in this part of the body that you're both focused on. So the therapist is putting their mindful attention into this part of the belly. The client is learning to bring his or her mindful attention into this part of the body, and then they're staying there together. So this is where, in the second stage of this intervention, we're just really helping someone learn how to bring attention in. And that, for people who have significant trauma histories and who may dissociate or not be very comfortable paying attention or have a lot of anxiety or fear about going inside, the work is all about how can we help you learn to bring attention in and have it be something you can manage to do.
This is great, Cynthia. This is great, and this process. The people who are watching this are, for most intents and purposes, just starting out. So even, you talked about language. The language you use is very important. We need to hear that. Just this idea of, okay, what language am I using? What language are you using? How am I doing that? The idea that someone's going to be using their hands, I would imagine that takes some work and some teaching. So is that a whole separate part of what MABT teaches too, this whole process of?
Absolutely. Yeah. So absolutely, we're helping the therapist learn how to really be present in themselves while they're working with their client, how to help maintain that presence, how to use their language to guide somebody, their client's attention into the body, how to assess presence in a particular part of the body, what to do if you don't assess presence in the part of the body, how do you back up and reteach and find the creative strategies to help support your client, bring their attention into the body. So it's a huge part of the training that we're doing. It's a huge part. And for body workers, some of this comes fairly easy because they do it. But not always. They're not really trained as body workers to focus on presence and to assess it. And for psychotherapists or people who are both body workers and have been Hakomi trained, for example, because I've worked with many of them, they too, they often have the concept of presence that they've really learned through Hakomi or other types of similar sort of mindful somatic-based psychotherapeutic strategies. But this idea of really combining that with touch is new. And so this ends up being where we spend a lot of the training time really is, in helping the therapists put all this together and develop these skills for themselves.
For those of us who are watching and they're like, this sounds great. I mean, I'd love to be able to work with my hand. Would you caution against using one's hands if they haven't been trained properly? I mean, obviously on one sense of the continuum, I could see, of course, but is there a way that a counselor or a therapist can use their hands without having gone through this course, for example, or this training?
Without having gone through it? I doubt it. I mean, there are other ways you can get, that a therapist could get some training on how to use their hands in the course of doing any kind of therapeutic modality, but there aren't very many people who teach this kind of thing. And what I mostly hear from both sides, the body workers who say, how am I not going out of my scope of practice by working in the emotional realm, and the psychotherapist saying, how am I not going out of my scope of practice by using touch? Those are really big questions for therapists on this spectrum of the folks that I typically work with or train. And for the psychotherapists, if they aren't licensed to touch because they're not a body worker or they're not a nurse or other kind of health professional like a physical therapist or a physician or a psychiatrist, they're all licensed to touch. Mm-hmm. But a psychotherapist alone is not. And in many states, it's a problem if on a legal level for them in their state. And every state is different. So many psychotherapists find a way to do this that feels comfortable for them. They either get the level of certification that might be available in their state that would allow them to use touch, and every state is different, mm-hmm. or they get enough training that they feel comfortable doing this even with a potentially gray or even not gray situation around their own psychotherapeutic license situation in their state. So it is something people need to figure out for themselves.
Sure. Yeah, and I wasn't suggesting people bypass this training to do that, but just I know touch is something that people, it's kind of like a hot potato, but I think a lot of people understand the value in that, mm-hmm. and what you're describing here just sounds extremely valuable.
It is very valuable. Psychotherapists, I mean, in the psychotherapy world, the reason it tends to be a hot potato is that is in part related to these legal issues that folks are told this isn't okay to do, and but around that is also this concern that people will be re-traumatized by touch in some way, or there's an increased risk for that. In our experience, that's absolutely not the case, and actually it's the opposite. That when clients get safe touch and they learn skills that help them reconnect with their bodies and thereby learn to reduce many of the automatic patterns that cause them to dissociate from their bodies, they are actually much safer. Mm-hmm. They are more in control and more embodied themselves, and they have a whole new set of skills for being in relationship to their bodies, which are all about recovery. So I've been doing research, for example, in community clinical settings for many, many years using this approach, and have had absolutely no problems in this regard. No adverse effects, no, in some ways I actually think with really learning safe touch, it reduces countertransference sorts of issues, that it's enormously helpful. Mm-hmm. And people are still scared of it, but that's really unfortunate.
Let's talk about, again, some of the language, and maybe even take a step back. I mean, obviously there are so many ways we can go in talking about this, but I do want to put a frame around kind of the early parts of this process. You talked about language. What are some of the things you might say to help you assess a person's awareness of mm-hmm. their bodily states, maybe even awareness of their trauma? Let's talk a little bit about that.
Yeah, at a very beginning level, we do a lot of time in our sessions that's just talking in a seated kind of psychotherapeutic type way, asking someone about all the ways in which they experience their bodies. What's comfortable, what's not comfortable, where they have, what kind of awareness they do have, what they do for self-care, what they don't do, why they're showing up, whether they have, from a trauma perspective, why are they here? If they want to attend to their bodies more, what about it is problematic for them? So we ask lots of those kinds of questions when it comes to actually, then we work on a massage table. And so that transition from being seated to the massage table, we're then moving into a position where we're saying, we're going to do some work on the areas that you said bother you, where it might be just some gentle sort of massage work for the therapist to both gain some sense of, well, what does this tissue actually feel like? Mm-hmm. How tight is it? Where is it tight? And then to ask these body literacy questions of the client, I'm putting some pressure here at the tops of the shoulder. How does this pressure feel to you in your tissue? How would you describe it? So we start there, and most of the time that transition for the client is pretty straightforward. They know what they're getting. They know what they're going to get. They're not, if someone were to say, I don't want to be touched in certain parts of their body, then we obviously won't. And there's a whole lot of conversation about making sure they feel comfortable. So there's a lot of check-ins all the time. Mm-hmm. Are you doing okay? How's this pressure? Are you feeling comfortable? There's just a lot of that back and forth going on all the time to make sure the client is very, very, feeling very, very safe with whatever happens.
The thing, Cynthia, that keeps coming up for me is, with trauma and trauma treatment, one of the things that is often discussed is the importance and the power of the relationship and how that's formed. And with the utilization of touch, that seems to even become even more pronounced and intense, right? Someone who's experienced trauma, walking into a clinician's office or a trauma worker's office, and oftentimes the trust isn't there, but you're talking about working with someone, using hands. That's very powerful, and I can imagine the trust and relationship, therapeutic relationship, of course, that can evolve potentially with that.
Mm-hmm. There's an enormous amount of safety that gets communicated through touch. Enormous amount. And when we talk about developing the client-therapist relationship, when touch is used in the process, that sense of safety in that relationship from the client's perspective is accelerated, I think, sometimes with this type of work, because they're experiencing the safety of that touch in a way that it's like a baby being held. You don't necessarily cognitively think about it, but it's this real sense of I don't know the best word other than safety, but I do think it gets communicated very clearly.
Yeah, it feels like more experiential than cognitive or intellectual.
Exactly. And that's where this work is so different from psychotherapy, right? We're bypassing, by focusing so much on sensory awareness, we're bypassing a lot of the cognitive barriers that get in people's way. A lot of the defenses and avoidance strategies from paying attention to internal experience. When you just go right after the sensation and present moment bodily experience without having all the mental defenses kind of having a way to play themselves out. So we're sort of just going into underneath the radar in a way with this work. And it does mean that I think it facilitates that relational piece very quickly. I also think that it helps to facilitate someone being able to make pretty quick progress, because you're sort of working from the bottom up versus the top down, which is where all our developed defenses are. So that's another thing I've really noticed a lot over the years.
Yeah, it makes a lot of sense to me. One of the things I'm realizing is this interview just feels like a really good justification for getting, training with working with your hands, not just MABT in a sense, but just I love what you're talking about here. I mean, this is I think for the first time I've really, it feels like I really understood the benefit of using one's hands in this kind of therapy, especially for trauma.
Yeah, and it isn't just for trauma. I think that so many people with trauma are challenged to be connected to their bodies, and so it's all the more useful in this realm.
Right. Is there a particular client that's come to mind that you particularly worked on, or maybe someone worked on, and can we talk a little bit about that process, what that might have looked like?
Yeah, I have so many people in my head that I tend to make these composite folks, but I don't think it'll make that much difference. Yeah, so a story of someone's experience is what you're thinking of. So I could go either of two directions, and I think what I'd like to do is a little bit of both. So in our research studies, we tend to work with folks who have absolutely no psychotherapeutic background whatsoever. They tend to be very low income, haven't had the resources to pursue psychotherapy, and may have comorbid other kinds of things going on, like substance use or depression or chronic pain, as well as a trauma history. So with these folks, the work is slower because it's all so new. And so I'll tell you a story about what that might look like of, just even help, so a person might come into the room and having that first session with the therapist and really learning what to expect and having these conversations, and that person may say, I have no idea how I feel. I don't pay attention to how I feel. And so the work then is really very, very, this is what I mean by fundamental. You're just really helping someone to even find words, and you choose some place that feels really safe for them, like the tops of the shoulders, for example, which for many people are tight, right? And so it's just helping them at very, very slowly pay attention to how the tops of their shoulders feel. And what often happens is that the person will, by the end of the session, say, I didn't realize that I'm walking around with my shoulders up like this, and that my tension, because I don't feel it so much anymore, that my tension is related to these stressful situations I'm in my relationship. So then you get this very beginning curiosity on the person's part. It's like, oh, maybe I can change my body posture. Maybe when I'm feeling stressed and at home, I can pay attention to how I'm holding my shoulders, and I can pay attention to how my body feels inside when I'm not responding by doing this. Mm-hmm. So you start with these really simple little awarenesses, right? Now you take, so that might be where you start with someone for whom this is all brand new, and the whole process moves much slower, versus a client who might have come to me, for example, in clinical practice, is referred by their psychotherapist, has done 20 years of trauma-based therapy, has an extensive trauma history as well, and is extremely highly functional, with a great job and a family, and not a whole lot of distress, except that they have these continued body memories. And they get in the way with nightmares at sleep. They get in the way with a person's intimacy in their romantic relationship that they're in. And otherwise, they feel pretty on top of it. But there's been this thread that has never been resolved. So this person's extremely sophisticated. They really understand themselves. They have a lot of awareness, but they clearly have something that is very bodily that has never been addressed in psychotherapy. So with this person, you have a very different trajectory. So they may come in and they may still say, I don't really have a lot of body awareness, but they may say no pain, no huge amounts of tension, but those body memories, when they happen, they cause me to feel constricted right here in my throat, and I don't know what that's about. I tend to ignore it. So then the whole focus is on bringing their attention into this very specific place in their body. And for these folks, let's call this person Sarah. She starts to come down into that part of their body, and she's absolutely terrified. She instantly is aware of how afraid she is. She doesn't want to come there. And but at the same time, yeah.
What might you say to
help someone?
Begin that process of bringing the attention there?
So when we've got this person's got a very clear goal, right? And I've got my hands like around the upper chest of this person. And we've already gone through, sort of on the outside level of attending to how did this part of the body feel. And we're working on her, bringing her attention down into this part of her body between my hands. And she's starting to bring her attention down, like out of her head and down through her neck. And she runs into that feeling of feeling really scared. In that moment, we just pause. In that moment, we stop the internal traveling process and we pay attention to her describing what that feeling of anxiety and fear is like. Where does she notice it in the body? Exactly. So she might say, well, I haven't gotten that far, so I'm actually right here in the neck. And so then again, we're going back to what can you identify? How would you describe it? What does it feel like on the inside? And we're now focusing a little more on the inside. And can you just stay right here for a few minutes? And that process of being with on the inside and holding that kind of therapeutic window of it's not being overwhelming, but they can manage it, but it's still uncomfortable, is where the work happens, right? So we'll call this person Carol, and she's able to maintain some attention in that internal part of her neck. And in those few minutes of just staying there, she's like, okay, this feels really edgy. I'm not really sure I like this, but I can do it. I'm staying there. My attention is staying there. This place in my neck feels constricted. It feels really tight. It feels like a black column that goes through my neck. And I'm aware that my whole body is anxious and tight. So that's where we'd start. And I would just ask her to stay with that. Do nothing but stay with it. And this is the mindfulness piece. It's like if you can learn to simply to simply hold that observation of yourself in a very particular part of the body, things will shift. And that's the sustained attention piece that we're working with. Can you just be with yourself in that place in your body and notice what happens? And what typically happens is, okay, that part of my neck is feeling a little more open. I'm feeling a little more relaxed. I think there's a lot of overlap with acceptance processes of not trying to fix it and get your head all in the way, which can lead to more anxiety, but rather this experience of simply being in a mindful relationship with a very uncomfortable place in the body. So it's very specific, right? We're not paying attention to the whole body. We're not paying attention to the feeling of the breath. We're not paying attention to anything but this one place in this very specific spot in the middle of the neck. And that's it.
Yeah, I love that. Let's I want to ask you to, I just want to be mindful of the time here. Can you, on the spot, come up with maybe a couple of takeaways that you want our viewers to take from this? I mean, because I'm listening to this and I'm like thinking to myself, this is amazing. My background is in sensory motor psychotherapy, but the use of the hands here and I love that integration and what you're talking about. So for those of us who are watching this and maybe they want to get into this or begin or just are intrigued, what would you say to them?
So I think I'm aware of just talking about some of these kind of baby vignettes is that it could sound kind of overwhelming and it's like, oh my God, what would you do with this and where would it go and what's the point in the long run? And I think the takeaway is that the point in the long run is that clients learn how to bring their attention into places in their own bodies that cause them discomfort, are connected to their ways in which their trauma still lives inside their bodies. And that gets shifted so that those places in their bodies are not holding that trauma anymore. And their relationship to their bodies is completely changed over time because they can develop the capacity to really be in their bodies and have their bodies be a place that feels safe and comfortable because they have bit by bit kind of learned these skills and then can have a sense of being more embodied themselves. And when you're more embodied and these dissociative patterns and the ways we can hold stress and not resolve them in our bodies dissipate. They really, really change. So the takeaway is that folks can have a very different sense of their own capacity to connect with their bodies and not have their bodies be a place that are holding on to all this stuff that can really get in folks' way who have significant trauma histories. And they then go home, they're learning these skills, they practice them at home, and they have ways that they can also use these skills for stressful situations that just come up whenever. And kind of, that, how we all do, something happens in an interaction with someone and we find our whole, we can feel our heart racing, we can feel our stomach contract, we can feel our throat contract, we can feel our muscles get tight. It's finding ways to sort of go, oh, wait a minute, what's really going on? How can I bring myself in? How can I understand better on a physiological level how to be with myself with this? So that's the other piece of this is having people learn some skills that go way beyond the session, that they are then integrating in as mindfulness practices that they can do in life to support their own embodiment and their own health. And that's the emotion regulation piece that I really think this work gives people skills to better emotionally regulate in the long run.
Awesome. I want to thank you so much for taking the time to do this. I'm excited to learn more about this. What's the best way people can get in contact with you?
So we have a website for our nonprofit center where we're doing trainings in this work. And so the website will describe this work, but also give people specific information on what the trainings and the next upcoming trainings are, and my email address if they have any questions. So it's www.cmbaware.org is the website.
Okay. www.cmbaware.org. Got it. I'll link that up here. All right, Cynthia, I want to thank you so much for taking the time to do this.
Yeah, my pleasure, Guy. Thank you so much for having me.
All right, guys, this episode is sponsored by Trauma Therapist 2.0, community to educate, support, to inspire new trauma healers. If you're a new trauma worker, new trauma provider and healer, you're starting out on this trauma-informed journey and you're tired of doing this alone and looking for support, looking to be around a community of other passionate trauma clinicians, I invite you to check out Trauma Therapist 2.0 at traumatherapist2.com. That's traumatherapist2.com. The Foundation for Human Enrichment, DBA Somatic Experiencing Trauma Institute, is a 501c3 nonprofit dedicated to resolving trauma worldwide by providing professional training and education in somatic experiencing. It was founded by Dr. Peter Levine, author of Waking the Tiger, who developed somatic experiencing based on explorations of how animals deal with threat and traumatic experiences on a daily basis. Learn more about somatic experiencing and the SE professional training at www.traumahealing.org. That's www.traumahealing.org.